All right, so today we're going to talk about drugs in the workplace and their signs and symptoms. So, as you all know, drugs are bad. They're illegal, they cause harm, they cause death, they cause you to lose your jobs, your families. They are just not a good thing to be around or do. So, for example, some drugs can make you feel overconfident. They can lead you to do things that you wouldn't normally do on a day-to-day basis when you are not impaired. They can make you lose track of time, space, just throw your mind out of whack and make you do things that you normally wouldn't do. So today, the first drug we're going to talk about is marijuana. Marijuana is known as a gateway drug. It can be used or believed to introduce people to more dangerous drugs down the line in their drug use. So marijuana is linked to coworker theft in the workplace. Now, that's not always the case. That does depend on the situation, the user, and the environment of the job. But marijuana is illegal in most states. It is not allowed in workplace environments. So an employee should not be using it or have it on them or be in possession of the drug. Now, some physical indications that somebody is under the influence is reddened eyes, slowed speech, a distinctive odor on clothing, and an irritating cough. Now, for those who may have been around marijuana, you do know that it has a very strong and distinct smell. So that is a very strong indication that somebody may be using it. Now, marijuana has some behavioral effects, such as a laid-back attitude, laziness, or a lack of motivation, paranoia, confusion, and anxiety. Now, they may be nonchalant, just going about their day, very mellow. So, but they also may be paranoid, looking over their shoulder, just acting on edge than what may not be their norm. So they also may be very slurred in the speech. They can be very slow, very nonchalant. Some physical indications are delayed decision-making, lack of concentration, short-term memory loss, and erratic cognitive function, and loss of time. Those under the influence may not realize how slow they're working, how uncoordinated they might be, and they could also just forget what somebody may have showed them or told them a few minutes before what they were doing. All right, so the next drug is cocaine/crack cocaine. And some physical indications that somebody may be under the influence is a runny or irritated nose, difficulty concentrating, dilated pupils and visual impairment, restlessness, overreaction to a stimulus, increase in sweating, and a dry mouth. Now, those of you who have seen somebody under the influence, or like me, seen it in a movie, after ingesting the drug, they get crazy. They feel on top of the world. That is a side effect of cocaine use. It's a very upper, energetic, motivating drug. It is also very dangerous. Very, very dangerous. Now, some behavioral indications are paranoia, talkativeness, anxiety, agitation, wide mood swings, hallucinations, restlessness, a God complex, and unusual defensiveness. Now, going back to the wide mood swings, since this drug is an upper, once you go up, you have to come down. So that's where the wide mood swings come into play. They are on this high for a while, and then they come down. And that is a very key telltale sign, along with the erratic, God complex behavior. That is a very good way to indicate if somebody may be under the influence of crack cocaine. Now, some speech indications will be speech will most likely be fast and excited. That, again, goes along with this erratic, high, upper drug. Performance indications are isolation from normal activities, erratic movements, secretive behavior, and extreme energy swings. Now, the isolation from normal activities at the job mean they might miss a meeting or go to the bathroom a little bit more, or just be very secretive. They want to go away, stay back from the crowd. That is because it wears off very quick, so they keep it on them, take a bump, get on with their day. Amphetamines, also known as speed, meth, truck. Now, the truck nickname derives from truck drivers because truck drivers have been known to use this to stay awake. As for the amphetamines, give them a sense of alertness. It gets rid of their fatigue and drowsiness that is associated with the long drives, night shift, and just being awake for extended periods of time. Now, some physical indicators are dilated pupils, profuse sweating, rapid respiration, panic, and restlessness. Some behavioral indicators are confusion, talkativeness, inability to concentrate, hyperexcitability, and depression. Now, the depression comes into play because, like before in cocaine, it's an upper. They feel good, they feel awake, they feel alert. Then they come down. Then they get slow, depressed, sad. Some speech indications is an increase in speech and their volume at what they talk. Some performance indicators are they give a false sense of alertness. They may seem more alert than what they are in reality. They may act on impulse. An example would be jumping to do something without thinking first, or doing something they normally wouldn't do, which would result in performing it with a risky manner. So that is definitely something to look out for if you suspect somebody may be on amphetamine. Now, hallucinogens are a very mind-altering, out-of-this-world drug. Some physical indications to look out for are dilated pupils, muscle rigidity, nystagmus, profuse sweating, rapid heartbeat, dizziness, and loss of balance. Some behavioral indications are agitation, confusion, impaired judgment, extreme mood shift, impaired reality. Slurred speech may also be existing with this drug. And some performance indications are violence and erratic behavior. Now, going back to the impaired reality, people using this drug are seeing things that we're not seeing. So they may act violent. They may act very erratic because they're seeing things that we're not seeing, and it's giving them this false reality and making them act very, very crazy. The last drug we'll be talking about is heroin or opiates. Now, some physical indications are dilated pupils, fatigue, nausea, vomiting, loss of balance, and loss of coordination. Behavioral indications, mood changes, depression, and apathy. Speech indications are slurred speech. Some things to look out for on the job site are physical and mental impairments when performing tasks. Now, you will most not likely not find this in a work setting. Most of these people, statistically, are not at work. They are at home, on the streets. They are not doing these drugs and working at the same time. The last thing we'll be talking about is alcohol. Alcohol abuse in the workforce is a much bigger problem than drug abuse. Alcohol is very accessible, is very easy to hide, and anybody over the age of 21 can go down to the local store and get it. Now, some physical indicators to look out for are smell. They may avoid interactions, staggering walk, exaggerated behavior, lack of coordination, slow mental process, and impairment. Behavioral indicators are depression, agitation, anger, fatigue, and confusion. Slurred speech is one of the main factors in speech indications. Performance indicators, poor coordination, delayed reaction time, and bad balance. For any of y'all who have been around somebody that is under the influence of alcohol, you know what they look like. They can't walk straight. Hand-eye coordination is poor, and they're slurring their words. So this is going to wrap up our presentation on signs and symptoms of drug abuse in the workforce. I hope you're able to use the information you gathered today and apply it at work.